मेरा नाम मनोज कुमार है। मैं राजस्थान सीकर डिस्ट्रिक्ट से हूँ और मेरा हेयर फॉल हो रहा था बहुत काफ़ी। तो मुझे किसी ने बताया यहाँ पे सारस्वत हॉस्पिटल के बारे में। मार्च 2023 में यहाँ पे आया था। तो मैंने यहाँ डॉक्टर से कंसल्ट किया, उन्होंने मेरे को एडवाइस किया हेयर ट्रांसप्लांट के लिए। 15 मार्च 2023 को करवाया था और अभी मुझे लगभग 7-8 महीने हो गए और काफ़ी अच्छा रिजल्ट है और मैं काफ़ी सेटिस्फाइड हूँ और बहुत अच्छा लग रहा है। थैंक यू सो मच।
You've heard to the testimonial of Mr. Manoj and how happy he is after 7 months of his hair transplant. But do you know how much worried and anxious he was about his hair loss problem when he first came to meet us in March 2023 before his hair transplant and had a lot of questions about the procedure. Is it going to work out for him or not? Is it suitable for him or not? What kind of medicines he has to take after the procedure? He used to avoid going out and avoid meeting other people because of this hair loss condition. He had a lack of self-confidence also because of this hair transplant. In this video, we will discuss how we analyzed his hair loss problem, what treatment approach we designed for him, how good his donor site was, and what were the steps of the procedure which led to this fantastic results in this case. I am Dr. Satya Saraswat, an American board certified hair transplant surgeon, and in this field for more than 17 years and have done thousands of hair transplants and treated thousands of such patients. Do subscribe to our channel if you want to watch these kind of useful and informative videos. Mr. Manoj visited us in March 2023. He is 36-year-old and had hair loss problem for many years before that and had tried some medicines which unfortunately did not work out for him. So the first thing we did was to do a detailed trichoscopy, which means that we found out how good his donor site was. He had an average density of 80 follicular units per centimeter square and his average thickness of follicles or hairs was 0.072 millimeter, that is 720 microns. We also calculated his recipient area calculations, which were approximately 75 centimeter squares. Since he had some hairs already existing, so we planned a density of around 35 follicular units per centimeter square for this area. He had a grade 3 Norwood male pattern hair loss. So with 35 follicular unit density in the recipient area, we found out that his requirement was between 2500 to 2600 follicular units. He expressed his desire to address the temple points also. So these temple points, friends, they're very important, and if not done in a perfect way, they can lead to standing of the hairs and can lead to unnatural and undesirable results. We told that temple points sometimes may not work out due to some reasons, and we discussed the science behind the temple hair point restoration also. He wanted this to address, so we calculated that he may need approximately 100 to 150 grafts of follicular units per temple point, and in the end the number came out to be 250 approximately follicular units for both the temples combined. In his case, we did approximately 2800 follicular units to address both the front and the temple points. You can see on the screen the graph distribution, number of 1, 2, 3, 4 hair follicular units, average number of hairs per follicular unit, and all the relevant data is available for you to see on the screen. Do pause for some seconds and look at how beautifully we have done his procedure and the number of graph distribution, how it has been done in his case. Do like this video if you are liking the planning in Mr. Manoj's case. Now let us discuss what steps, the operative steps we did in Mr. Manoj's case. You may be knowing the steps already, but just to run through that, first thing we do is marking the hairline, trimming the hairs, and giving the local anesthesia. So the local anesthesia we give in a ring block fashion, which means we cover the entire local anesthesia in a single go. We do not do patchy local anesthesia, that this part once and again and again and again and again. We do it in a single sitting, and then this takes around 10 minutes or so, but after that you do not feel the pain at all during the entire procedure. To give local anesthesia, we use vibration devices, cooling devices, and very fine needles are used so that this does not hurt you. It just feels like a temporary discomfort, like a ant bite, nothing more than that. And once this is done, this area becomes totally numb. After this, we make the slits, keeping in mind the normal angle and direction of that particular area. This is very important to maintain the angle, especially in the temple points. Here, the angle is almost 0 to 10 degrees, which means the hair which are coming out normally are flat here. If the angle increases, this can lead to very distorted kind of hairs coming out and they look very, very unnatural. This is done by bending the needle twice at 2 points so that once we make the slits here, they are almost parallel. Similarly, we did the slit making in the front. After this, we changed the position and started extracting the grafts from the back using a low speed, low RPM machine, low rotation per minute speed machine and a low torque machine. This minimizes the damage of the follicular units extracted and also does not cause any thermal damage to the graft follicular units or the underlying or nearby structures. So with this we get very good quality roots. For this step we use very highly advanced magnification devices like Carl Zeiss loops, and they have a magnification of around 4 to 5, which means a small thing is seen 4 to 5 times bigger. This also minimizes the chances of damage to the roots which are extracted. After this, the grafts are sorted under microscope into 1, 2, 3 and 4 hair grafts. After the graft sorting has been done, the graft insertion is done in the slits which we have made. And in this, we do the single hair follicular units for the front. We do a 3 and 4 follicular units for the tuft area, and for the rest we do 2 or 3. Temple points generally need a single hair follicular units which are softer in nature. So this is the roughly the kind of all the steps we do in a hair transplant. This may be modified as per the requirements of the patient also. You can call us or comment in the down section below if you are planning your hair transplant or looking out for hair loss treatment. Do watch the before and after pictures of Mr. Manoj, and do see the combing videos, even the wet combing videos which show the hair volume which Mr. Manoj has got after this hair transplant. If you want to know the cost of hair transplant, please watch the video on the left. Thank you.